Hi everyone, my name is Rakia, I'm an infection prevention and control nurse. Today we're going to talk about something that affects all of us in healthcare. Healthcare-associated infections, or HAI. You might think of them as those sneaky little germs that follow us into the hospital and try to cause trouble. But the good news is, most HAI are preventable. So let's dive in and learn how to stop them. Starting with understanding what they are, how they spread, and what we can do to fight back. Together. Alright, here's what we're going to talk about today. First, we'll make sure everyone's clear on what HAI actually are. Then, we'll go over the common types you see in hospitals, and how these infections spread. After that, we'll talk about simple but powerful ways to prevent them. And finally, we'll wrap up by talking about teamwork. Because infection control isn't a one-person job. It's something we all need to do together. HAI, or healthcare-associated infections, are infections that a person gets while receiving care in a hospital or other healthcare setting. They are not related to the patient's original condition. Onset usually more than 48 hours after admission. According to the CDC, if an infection begins after 48 hours of hospitalization, it's likely considered an HAI. In outpatient settings, HAI may also occur after medical procedures. To be classified as an HAI, the infection must have neither been present nor in the incubation phase when the patient was admitted. Here are the most common types of healthcare-associated infections. 1. Catheter-associated urinary tract infections, CAUTI. This occurs when a urinary catheter is in place and bacteria enter the bladder through the catheter. It's one of the most common HAI, especially when the catheter is left in too long or aseptic technique is not followed. 2. Ventilator-associated pneumonia, VAP. VAP happens in patients who are on mechanical ventilation. Germs can enter the lungs through the breathing tube, especially if oral hygiene, suctioning, or ventilator circuit care is inadequate. 3. Central line-associated bloodstream infections, CLABSI. These are serious infections that occur when germs enter the bloodstream through a central line, such as a central venous catheter. Poor hand hygiene or improper dressing changes are common causes. 4. Surgical site infections, SSI. SSI happen after a surgical procedure, often at the incision site. They may be superficial, skin, or deep, involving tissue or organs. Proper pre-op skin prep, sterile technique, and post-op care are critical to prevent them. 5. Clostridioides difficile infection, CDI. This is a gastrointestinal infection caused by overgrowth of C. difficile bacteria, often after antibiotic use. It leads to severe diarrhea and inflammation of the colon. Good hand hygiene and environmental cleaning are key to preventing its spread. The routes of transmission for healthcare-associated infections are via several main pathways. Contact transmission, direct and indirect. This is the most common route in healthcare settings. Direct contact means physical transfer of microorganisms from one person to another. For example, when a nurse touches an infected wound and then touches another patient. Indirect contact happens when pathogens are transferred via a contaminated object, such as a stethoscope, bed rail, or four-pole. Droplet transmission. Droplets are generated when an infected person coughs, sneezes, or talks. These droplets can travel short distances, usually under 1 meter or 3 feet, and land in the eyes, nose, or mouth of nearby persons. Examples of diseases spread by droplets include influenza, COVID-19. Airborne transmission. In this route, infectious agents are carried by tiny droplet nuclei or dust particles that remain suspended in the air for long periods and can travel over long distances. Diseases like tuberculosis, measles, and varicella, chickenpox, are transmitted this way. Special ventilation and N95 respirators are required for protection. Contaminated surfaces or equipment. Pathogens such as MRSA, C. difficile, or VRE can survive on surfaces like bed rails, doorknobs, or medical equipment for hours or even days. If healthcare workers or patients touch these surfaces and then touch their face or wounds, transmission occurs. Hands, the primary vector. According to both WHO and CDC, the hands of healthcare workers are the most frequent route of HAI transmission. Poor hand hygiene allows germs to pass between patients, equipment, and the environment. That's why hand hygiene is the single most important measure to prevent healthcare-associated infections. So, what is a risk factor? Prolonged hospitalization. The longer a patient stays in a healthcare facility, the higher the chance they will be exposed to hospital pathogens. Extended stays often lead to more device use, more procedures, and more opportunities for contamination. Invasive devices, catheters, ventilators, etc. Devices that break the natural skin or mucosal barriers. like urinary catheters, central lines, or ventilator tubes. provide a direct entry point for pathogens. The longer these devices remain in place, the greater the infection risk. Overuse or misuse of antibiotics. Unnecessary or inappropriate antibiotic use can disrupt normal flora and promote the growth of antibiotic-resistant organisms, such as MRSA or C. difficile. This increases the risk of HAI and makes them harder to treat. Immunocompromised patients. Patients with weakened immune systems, those with cancer, HIV, diabetes, organ transplants, or undergoing chemotherapy, are more vulnerable to infections, even from organisms that might not harm healthy individuals. Poor hand hygiene compliance. Hand hygiene is the most effective way to prevent transmission of infections. However, poor compliance among healthcare workers remains a major contributor to HAI. According to the WHO, average hand hygiene compliance rates worldwide are below 50%. Now that we understand the risk factors, let's talk about what we can actually do to prevent HAI. These are the 5 key strategies recommended by the WHO and the CDC. And they're all practical steps that we, as healthcare workers, can control. Hand hygiene. Hand hygiene is the cornerstone of infection prevention. According to the WHO, performing hand hygiene at the right moments, especially before touching a patient or after exposure to body fluids, can reduce HAI risk by over 50%. Alcohol-based hand rubs and proper hand washing with soap and water must be available and used correctly by all staff. 2. Proper PPE use. Personal protective equipment, PPE, including gloves, masks, gowns, and eye protection, must be used based on the level of exposure risk. Training staff on when to use, how to don and doff PPE, and disposing of it properly prevents cross-contamination and protects both patients and healthcare workers. 3. Standardized cleaning and disinfection. Environmental surfaces and medical equipment can harbor dangerous pathogens. Using standardized, evidence-based protocols for daily and terminal cleaning, especially in high-touch areas, helps stop the spread of HAI such as MRSA or C. difficile. 4. Safe management of invasive devices. Every catheter, central line, or ventilator should be inserted using aseptic technique, documented, and assessed daily for necessity. The longer these devices stay in, the higher the risk. Removing them as soon as they are no longer needed is a key safety measure. 5. Antibiotic stewardship. Overuse or misuse of antibiotics promotes resistant organisms. Antibiotic stewardship means using the right drug, at the right dose, for the right duration, and only when truly needed. This protects patients and preserves the effectiveness of antibiotics for the future. Since hand hygiene is the most important measure in preventing healthcare-associated infections, let's take a moment to review its key points once again. The WHO defines 5 key moments when healthcare workers must perform hand hygiene to prevent the transmission of microorganisms. Before touching a patient. Before clean/aseptic procedures. After body fluid exposure/risk. After touching a patient. After touching patient surroundings. These moments protect both patients and healthcare workers and should become an automatic habit in all care settings. Wet hand washing versus alcohol-based rub. Alcohol-based hand rub is preferred when hands are not visibly dirty, because it is fast, accessible, and effective against most bacteria and viruses. Wet hand washing with soap and water is necessary when hands are visibly soiled, after using the toilet, or when dealing with spore-forming organisms like Clostridioides difficile. WHO recommends placing alcohol-based rub dispensers at the point of care for quick access. Whether using alcohol-based rub or soap and water, hand hygiene must follow the correct steps. Cover all hand surfaces, palms, back of hands, between fingers, fingertips, and thumbs. Rub for at least 20 to 30 seconds alcohol-based rub or 40 to 60 seconds, soap and water. Training and observation help improve technique and reduce missed areas. To ensure hand hygiene is actually practiced, hospitals should conduct regular compliance audits using direct observation or electronic monitoring. Local data can be used to give feedback, identify gaps, and target improvement efforts. You can mention your facility's current compliance rate here. For example, currently, our compliance is 42%, our goal is 80%. Infection prevention and control isn't something one person can do alone, it takes a team. That's why we need to build a strong, team-based IPC approach in our facility. First, we need clear and consistent institutional IPC policies that everyone follows. This sets the foundation. Second, we should perform daily assessments on all invasive devices, like catheters and 4 lines, to decide if they're still needed. Unnecessary devices increase infection risk. Third, establish an IPC committee that includes doctors, nurses, and support staff, and provide regular training sessions so everyone stays updated. Finally, we must encourage open reporting of incidents, near misses, or risky practices, without blame. When people feel safe to speak up, we catch problems early and prevent harm. In short, IPC is everyone's responsibility, and it works best when we work together. Before we finish, let's remind ourselves of a few key points. Every one of us, doctors, nurses, cleaning staff, and support teams, plays a critical role in preventing healthcare-associated infections. Hand hygiene and teamwork are not optional. They are the foundation of safe care. When we prevent infections, we're not just protecting our patients. We're protecting each other, our families, and our healthcare system. Thank you for your attention, your dedication, and your daily efforts to keep our environment safe. Together, we make infection prevention possible. Thank you everyone for your attention and participation. Let's keep working together to prevent infections and protect our patients and ourselves. Teamwork saves lives. Thank you.